Europe's Medicines Agency says there is a link between AstraZeneca's COVID-19 vaccine and blood clots. Further research needs to be done to determine the reason why it happens. Several European countries, including Italy and Germany, suspended use of the jab over blood clot fears almost a month ago. But they resumed vaccinations after the EMA said that the benefits outweighed the risks. Lucy Hough joins us live now from Brussels. Lucy, still no clarity on what might be causing these incidences of blood clots.
No, but what we have heard is from this senior official from the European Medicines Agency, Marco Cavalieri, who's spoken to an Italian newspaper in an interview published today, saying that there is a clear link between these rare cases of blood clots and the Oxford AstraZeneca vaccine, although the reasons for the developing of that blood clots are still unclear, and that EMA is continuing to investigate the possible cause. However, the official guidance from the European Medicines Agency remains still that the benefits of the vaccine still far outweigh the risks. But nonetheless, since these incidences of blood clots first started being reported, we know that a number of European countries have responded by restricting the vaccine in some way. These incidents seeming to particularly affect younger women, with around 30 cases of people in Europe between the ages of 20 and 63. But you compare that to the number of people who've received this vaccine, which is now in excess of around 20 million. So a small number of cases, but this senior official from the European Medicines Agency says that there is a link between the vaccine and blood clotting in the brain, and that there will be further investigation.
It has been a relatively small number of instances of blood clots, but the agency has also stood by AstraZeneca. Could it change its stance now?
Well, its stance has been very clear that the benefits of receiving this vaccine far outweigh the risks in terms of reducing the rates of COVID-19, in terms of the rates of hospitalisation and death, and that we are talking a very, very small number of cases in relative terms, given how many millions of people have received the dose, both here in Europe and in the UK as well. So whilst the official guidance remains again, the benefits outweigh the risks, we are likely to receive further guidance. The senior official who spoke to the Italian newspaper, Marco Cavalieri, saying that advice could come as early as today. We could expect that announcement tomorrow as well. But EMA is meeting at a committee level to assess the evidence of this blood clotting. But meanwhile, the vaccine has been restricted in the under 65s in countries such as Germany, France and Spain, amid concerns that this blood clotting does appear to affect younger people and particularly women. We are also told that the UK's health regulator is also investigating these incidents of blood clots, with again around 30 cases reported there and 7 fatalities, and that an announcement following France and Germany in terms of restricting it in younger people, in this case under 30, could come as early as this week.
Thanks very much, Lucy. Lucy Hough reporting from Brussels.